Assalamu alaikum, my dear students. Today I am Dr. Sadia Mehjabeen welcoming you all to our today's online class. Our today's topic of discussion will be on renal circulation. That means the blood supply to the kidneys. We know kidneys are essential for our life because it excretes the metabolic waste products from our body to the exterior. Different types of metabolic components are excreted by our two kidneys, and the blood supply to the kidney is actually maintained by renal artery, which is a branch of abdominal aorta. These renal artery, after entering into the kidneys, divided into different branches, just like interlobular arteries, arcuate arteries, interlobar arteries, and they give rise to the afferent arteriole. These afferent arteriole then gives branches to the glomerular capillaries. From the glomerular capillaries, the blood then goes to the efferent arteriole, which is one of the peculiarities of the renal circulation is that the blood from the capillary doesn't go into a venous. It goes an efferent arteriole. Then it goes to different types of interlobar, interlobular arcuate veins, and lastly it drains into the renal vein and to the inferior vena cava. This is as a whole the renal circulation. So what is the renal blood flow? It is actually the amount of blood that enters into our kidneys in each minute. On an average, its value is about 1100 ml. And if we think about its ratio with the cardiac output, which is known as renal fraction, it is actually the ratio of renal blood flow to our cardiac output. So if the renal blood flow is 1100 ml and the cardiac output is about 5000 ml, we get the renal fraction as 22%. So from 22% of the cardiac output, the kidney gets its blood. Kidney has got the highest blood flow per unit volume of the kidneys. So why this highest volume of blood flow is needed in the kidneys? So that the metabolic waste products can be excreted properly, and the main function of the kidney is to be maintained by this renal blood flow. So when we think about renal blood flow, another thing we have to keep in mind, what is renal plasma flow. It is same like the blood flow. It is the amount of plasma that enters into the kidneys in each minute, and the normal value of renal plasma flow is about 670 to 700 milliliter. So renal blood flow is about 1100 ml and the renal plasma flow is about 700 ml, and the renal fraction is about 22% of the cardiac output. So these are the very basic things of renal blood flow. So our next question may come like that: what are the regulators of renal blood flow? That means what are the factors that regulate the renal blood flow? There are some factors that dilate the vessels of the kidneys, and there are some factors that constrict the vessels of the kidneys. So what are the factors that dilate the kidneys? There is nitric oxide, there is different types of prostaglandins that vasodilates the kidney and increases the renal vessels diameter and increases the renal blood flow. And there are some vasoconstrictor substances that actually lessen the blood flow or decreases the blood flow. So what are the vasoconstrictors that lowers the blood flow or decreases the blood flow? We have got sympathetic stimulation, and there are some hormones and autocoids just like epinephrine, norepinephrine, endothelin, angiotensin 2, dopamine. They actually vasoconstricts the renal vessels and lowers the renal blood flow. We have got also some factors that affect the renal blood flow. What are the factors? The factors are blood pressure. The arterial pressure is a strong factor that alters the renal blood flow. But there is a range of constant renal blood flow, though changes of the blood pressure. And these constant regulation of the renal blood flow is known as autoregulation of renal blood flow. If the blood pressure is less than 80 millimeter of mercury, then renal blood flow is decreases. And if the blood pressure is more than 180 millimeter of mercury, then the renal blood flow increases. So there is a wide range in which the blood pressure changes doesn't causes change in renal blood flow, and the pressure range is 80 to 180 millimeter of mercury. So if the pressure is less than 80, blood flow decreases. If it is more than 180, blood flow increases. But within the range of 80 to 180, blood pressure, the blood flow remains constant. Okay. Now there are other factors just like stress. Stress lowers the renal blood flow. High protein diet, it also increases the renal blood flow. High protein diet increases the renal blood flow, whereas the stress decreases the renal blood flow. The position, the posture of the person, it also has effect on renal blood flow. And if there is chronic renal diseases, just like chronic glomerulonephritis, chronic kidney failure, they also reduces the renal blood flow. So these are the factors that actually affect the renal blood flow. One of the important thing we have to study from here is the peculiarities of renal blood flow or peculiarities of renal circulation and its functional importance. As in physiology we are concerned about the function, we should know it, why there are peculiarities in renal circulation and what are the functional importance of these peculiarities. First thing is that renal circulation is a portal circulation. It has got two sets of capillaries. Okay, one of the capillary is glomerular capillary and another capillary is the peritubular capillary. What is the importance of glomerular capillary? Glomerular capillary helps to form the glomerular filtrate. It is the first step of urine formation, forming glomerular filtrate. And what is the function of the peritubular capillaries? The peritubular capillaries helps to form tubular reabsorption and tubular secretion. So the peritubular capillaries that are originated from efferent arteriole helps in tubular reabsorption and tubular secretion. So this is the number one peculiarity, having two sets of capillaries in the kidneys. Second important thing is that kidney has got high rate of blood flow, and the importance of this high rate of blood flow is that high rate of blood flow increases the glomerular hydrostatic pressure and favors glomerular filtration. So if there is high hydrostatic pressure due to high blood flow, GFR will be more. Third one is that the kidneys have got very selective blood flow. In different regions of the kidney have got different amount of blood flow. In the cortical region, there is about 90 to 95% blood goes to the cortical region of the kidney, that is in the outer region of the kidney, and the inner part of the kidney has got less blood flow. What is the functional importance of this? The functional importance is that, as we know, in the cortex most of the nephrons are present. So if the cortex has got more blood supply, more blood can be supplied to most of the nephrons. Okay. Now come to another peculiarity of the kidney. Another peculiarity is that it can autoregulate its blood flow. That means it can control its blood flow to a change of blood pressure. Okay. Another peculiarity of the kidneys is that it has got vasa recta. What is vasa recta? The vasa rectors are blood vessels or capillaries, just like peritubular capillaries, present in the juxtamedullary nephrons. That means the nephrons nearer to the medulla have got this vasa recta, which is a hairpin-like manner present along with the loop of Henle, and it helps in the formation of concentrated urine. Without the vasa recta, the urine doesn't become concentrated, so it is very much important. And a very peculiar fact about kidney is that if the blood supply of kidney is damaged or the kidney becomes denervated, no nerve supply to the kidney, the blood supply of the kidney can remain intact. Why it is important? So it maintains its main function properly. That means it can excrete large amount of metabolic waste products. So these are the peculiarities of the kidneys and their functional importance. It is very much important for you. The last thing we need to discuss in our topic, it is the autoregulation of renal blood flow. That means it is the intrinsic property of our kidneys to regulate the blood flow. There are actually two mechanisms by which kidneys regulate this blood flow. One of the mechanism is the tubuloglomerular feedback mechanisms, and the second mechanism is myogenic mechanism. So what is tubuloglomerular feedback? That means tubules send feedback to the glomerulus so that it controls the renal blood flow. Tubuloglomerular feedback mechanism actually occurs when there is less blood pressure. So if the blood pressure is less, then there is less blood flow to the kidney. Renal blood flow is less. If the renal blood flow is less, there will be low GFR. GFR will be low. Glomerular filtration will be less. If the glomerular filtration is less, then there is less amount of sodium ion and chloride ion in the tubular fluid. And the macula densa of the juxtaglomerular apparatus can detect this change of sodium and chloride concentration, and they secrete renin and they dilate the efferent arteriole, which if there is a dilatation of the efferent arteriole, then there is increased renal blood flow. So the effect of low blood pressure is minimized. The next mechanism is the myogenic mechanism. What is it? It occurs when there is high blood pressure. In case of high blood pressure, there is increased renal blood flow and increased tension on the renal vessels. And the smooth muscles present on the renal vessels causes the vasoconstriction. And if there is vasoconstriction, the renal blood flow will be lower. So by this way, the myogenic mechanisms during increased blood pressure, by stretching on the vascular wall, it reduces the renal blood flow. So by these two mechanisms, the kidneys maintain their blood flow. So this is all about from the renal blood flow. Thank you for watching and thank you for listening. Next week we will bring some new topics in our discussion. Till then, thank you very much and Allah Hafiz and Fi Amanillah.